Hello and welcome to AXA Health Chats. I'm Dr. Imren Sterno and I'm joined by Harriet Davidson, Clinical Services Manager at AXA Health. Today we'll be talking about childhood mental health and thinking about some tips and insights and how to talk to your child and how to think about the kind of support that's out there. So Harriet, with the increase of mental health awareness everywhere, so you can't open the newspaper, you can't, in magazines, on the TV, on the news, even in schools, the word mental health is everywhere. So in your experience of working in private medical insurance and at AXA Health, what have you seen in terms of referrals?
I've just had a massive increase in under 18s, especially since COVID hit.
Okay.
And because there was more awareness, there was more talking about mental health, which is really good. And it is great that more people are talking about it. But the increase in referrals for under 18s for such things as eating disorders, depression, body image, anxiety, self-harm. And we're going down to the ages of 5.
So a lot younger than what we've traditionally seen is what I'm hearing from you. So when we think about the NHS and community mental health services, CAM services, they've seen a huge increase in numbers as well. There's been a huge shift in the need for support and help. And I've never seen, my 20 years experience working privately and, in the NHS, I've never seen such an increase of referrals. Literally it's skyrocketing. It's really interesting, isn't it? Because I think you said with the younger age groups, what we're noticing is younger children with bullying, it's really becoming much more problematic, and also going back to school. So much like us as adults, the world changed for everybody during COVID for different reasons. And going back into the office has been really anxiety provoking for adults that we're seeing because, suddenly people are hot desking. They don't know who they're sitting next to. They don't know what to expect. What to wear, who's in the office, all these things can really be anxiety provoking. And then if we relay that down to a child who's been used to staying at home with mum and dad, who's probably changed their whole routine, children like to know what to expect. All of these things are impacting. And with the waiting times, I think it's just exacerbating that. And that's not a criticism because we know that the NHS do a fantastic job. I worked there for 20 years. I owe my career to them, really. But it is the reality of what we're seeing. So COVID was one thing. What other things do you think are impacting on that increase? What are your thoughts on that?
Social media
has
a lot of impacts on adolescents and on children because they're going on it younger. You've got, obviously, social media, different platforms on social media where they give off this image of perfect body, the perfect weight, perfect look, and the perfect life, and what the perfect life should be, when we all know that isn't reality, that isn't normality. And young people feel very, very pressured that that's what they've got to look like, that's what they've got to achieve, and that's what they've got to do. And we're seeing that a lot more in the referrals that were coming through into us in regards to peer pressure, eating disorders. It was that social interaction that was lost during COVID, which is so important with young people's development, with their brain development.
Yes.
Stopping that and then restarting that again as well with their skill, building those skills up again.
It's that connection, isn't it? And I think that's something that we see a lot in research that's coming out about individuals, children and adults feeling not connected and not being part of something, and that uncertainty of knowing how to behave, what boundaries are, all of those things, absolutely. Those soft skills, I guess, that we develop at school, and we take through into adulthood, sort of got lost for a while. I think other things that we're seeing, and when we're talking to families that we're noticing, is there's a lack of support in communities as well. So lots of services have been shut down. I know you and I were only talking the other day about when we had our children, all of the family child centres that were available, which has really reduced as well. So I think, a lot of individuals forget that they have the school nurse to go to for primary age children and senior school, which is a great resource, and also calling GPs, because sometimes we forget that we can just call and get advice because it feels like all services are so pressured. So it's really important to remind everybody of that, I guess. Thinking more about treatments and what we're seeing and what people are asking for. What sort of things are you seeing in the private medical world?
So we're seeing a lot more requests for therapy.
Okay.
And family therapy as well. Because we all know sometimes when a child is unwell, whether that be mental health or physical health, and as a parent, it can be a very worrying time.
Absolutely.
And what we're getting again is sometimes the parents calling up for a bit of support, a bit of advice, a bit of signposting. Sometimes that is advising them that they, again, calling the GP unless they, or friends. Friends are a really good support network. Although, yes, they may be specialists. But that peer support is really, really useful.
So in terms of thinking about what families ask us, so in therapy, what I get asked a lot is, what should I be looking out for? What are the signs? How do I know I need to seek support? Because everyone knows the earlier we get support for our young people and for ourselves, the better. What signs would you say from your experience as a mental health nurse would you recommend parents look out for?
I think as a parent, every child is different. And we all know what their normal is.
Sure.
So is anything what isn't their normal. So it could be that they're withdrawing from their normal activities. So, for example, they could be playing football every weekend and then they might not want to play every weekend. If they start just not engaging with you as much as they might normally have done. But again, it's learning what is normal for your child and what their normal behaviour is. And it's kind of anything that is slightly different to that might be a sign that there is something going on.
Yeah, absolutely. And I think it's really interesting. You and I, we often say we hate the term normal, but I think what's normal for your child and what is their everyday behaviour, and it's anything outside of that, isn't it, that we would look for. And for some parents, what we forget is there might be things going on at school that we're not even aware of. There might be a change in teacher, or there might be a big trip coming up where a child might be feeling anxious and we're not even aware of it. So it's all these little things that the more you get to know your child and the more you can monitor their behaviour a bit more, that there's the clues, I guess. And I think as clinicians, we're a bit reluctant to give a whole list of tips because, like you say, every child is different. So what might be normal for my girls might be very different for your daughter, for example. And it's that thing, isn't it? I do think mood changes is really important to monitor. But teenagers are tricky in terms of mood swings and in terms of what's normal for a teenager. But what I would suggest and what I've seen in treatment is when teenagers start running to the toilet a lot more, when they're isolating themselves even more than the norm, and when they're not engaging with their peers, and you're noticing that shift in their behaviour. I guess they're the key things, aren't they?
Yeah, absolutely. And yes, we all know teenagers are tricky. They're going through hormones, they're going through puberty. So there's all these added extra things kind of going on, I think, but you've also got to look at, has also something happened within the family?
Yes.
So it might not be what you might class as a significant change, but it could be moving house, it could be moving school, it could be a bereavement in the family.
Yes.
It could be any little, and I say little thing, and I'm not trying to either reduce the significance of it, but if there's been something that might have changed, or parents breaking up, and stuff like that, that can have an impact on that. Obviously, it will have an impact on their behaviour, but that's also just to be kind of aware of that might be having a continued effect on them.
Absolutely. And I think financial matters as well in the family home. There's a lot more pressure on families now, as we know, cost of living, all of the difficulties we're seeing. Again, how we talk about that in the family home, and if kids hear things, kids are amazing. They have very big ears and good hearing, and they hear all sorts of things that you probably wouldn't expect them to be hearing, and they feel things from us too. So what I always say to parents is every action has a reaction. So if you're going to talk to your child about the worries that you have for them or about a big change, if you can be calm and keep your tone, really level, and just talk quietly and slowly, it does help, because as you escalate, they escalate because they respond from you. It's a bit of a domino effect, isn't it? But we're not perfect parents, and I am not at all suggesting that I am by any stretch of the imagination. It's so difficult, isn't it, to sometimes contain ourselves. But if you can talk to your child, I guess, in that calmer manner, because like you said before, we really want to know, we really want to help. And it kind of becomes this kind of mission sometimes for us as parents to, what's going on? I know something's wrong. Just tell me, come on, I'm here for you. But that could be really difficult as well, can't it, for a child?
Absolutely. And it's really hard as a parent to kind of balance that wanting to help, but then not over pressurizing them.
Yeah.
Because you can over pressurize them and they'll just pull away even more.
Absolutely.
And it worked out when I worked in child and adolescent inpatient services in the NHS. is that as much as nurses and in a mental health environment, you are wanting to find out what's going on.
Yeah.
And you've just got to have that bit of that balance of letting them know you're there for them if they want to talk, but always reassuring them that you're there, but not overdoing that.
Yeah.
And it's really hard. It's really hard to gauge that balance, because no one can tell you what is the right balance, what isn't the right balance. It's what works for you and your child. But it's always being available for them as well. So if they are trying to tell you something, and as much as we're busy, as adults, we've got busy lives and we've got work, you've got friends, you've got all sorts of things. And I'm not saying anyone dismisses their child or anything like that, but sometimes your child or just wants to talk, and it might not even start out as a talk about their mental health. It could be just how their day's gone. And then you might find out, oh, that's happened. That's happened at school. And then it just opens that conversation.
Absolutely. And I think it's inviting them in. It's opening the door to that, isn't it, as well? And I also find that children learn from us. So that's what we forget, that modelling. And I always say to my kids that I'm not perfect. I do make mistakes, but there's always ways to repair. There's always ways to come back from a mistake. And I think children really want to please us, and they want to really try hard to, I guess, show us how much they do care and how hard they're trying. So if they do make a mistake, or if they get into trouble, or if something isn't going well, sometimes they don't always want to come to us. And it's just reminding them that nobody's perfect and that we all make mistakes. And I think having that conversation, because I get asked a lot, how do you talk about mental health with an 8-year-old, a 10-year-old, a 12-year-old? And exactly what you said, I think the best thing you can spend on your child is what I say to all my patients, is time. Yeah. That is the best thing you can spend with your child, is time. It's not all the gifts, it's not all the great holidays, which are lovely, by the way. We all enjoy a holiday, but it really is that time to get to know your child and to make space. And I think as parents, we're really busy. You're right, we want to try and fit everything in. And I don't know what it's like in your home, but, the kids come home, dinner, bath, bed, and homework somewhere in between. And it's just, before it's 8:30 and you sit down,
have that moment of peace. It's learning that sometimes with kids and their behaviour that they sometimes exhibit, which can be very difficult. It can be very hard work. What parents need to, I find, is remind is that you are their safe place.
Exactly.
You are the place where they can test those boundaries, where they can be angry, they can be shout, they can test what's right and what's not right. And I think we as parents forget that sometimes. And we pull our hair out. We're like, why are they angry? Why are they shouting?
Why are you behaving like this? Yes.
And it's how they learn also, their social interactions as well. Because you do find when you go out, they're lovely. They're, really polite most of the times.
Yes.
But it's also remembering that it's also letting them be able to express that.
Absolutely.
Express that emotion. Because children don't know how to manage their emotions. They can't regulate them up until they're a lot older. And I think sometimes we all forget that as well.
And emotion
because
regulation.
You don't remember learning how to regulate your emotions.
Yeah, absolutely.
You don't remember how you did it. You kind of learn from your parents, or you learn as you grew up. And as clinicians, sorry, you were
no, absolutely.
But, I think it's just learning what is their emotional regulation, and have they learned how to process that.
And I think it's something that you learn throughout life as well with emotion regulation. And I think we forget that for children, they're trying, like you said, work out their boundaries, work out what works for them. And sometimes how they behave at school is very different to how they behave at home, because the structure is different, because how we respond might be different. And that's where many parents say, well, at school, they never have this problem. They never, have a tantrum. They always eat their lunch. But at home, the plate gets thrown away. I'm not eating that. Tantrum, really dismissive towards what mum and dad are asking them to do around homework, whereas at school, teacher says they're being perfect. But then what I would suggest is to think about what's different at school, to think about who's around them, to think about maybe how they've been asked to do something, or how the situation is contained. Because it is really difficult, and nobody's a perfect parent, and nor should you strive to be, because there's no such thing, I think. And we talk about this a lot, in services and as clinicians and as parents, towards support for each other. What I would say is it's really important as a parent to get support for yourself. if you're struggling, if you're worrying about something, it demonstrates that you really care. You know, worry isn't always a negative thing. As a parent, if you're sensing there's something going with your child, there probably is, because you know your child best. So I think it's about getting support, not being afraid to talk to your friends, like you said before, family members, other people that have got kids, and speaking to school nurses is really important, I think, teachers, and then also using your GP services and reaching out if you have PMI to get that additional support.
Absolutely. But it's also showing your child that it's okay to ask for help.
Absolutely, yeah.
By role modelling behaviour. Because if they see you go like asking for help or asking for support, they might be more inclined to for themselves to ask for help and support. But yeah, absolutely, using your peer support, using the GPs, and seeing what is available around in your own community as well.
And I think we forget that, you know, some great resources on the internet, like the Mind website is something I always go to. There's lots of great tips on there and help. And if you are more concerned about the more severe end of things, you know, there's some great advice on there around self-harm, around, you know, bullying and how to seek help and how to talk. So, you know, you're not alone. And there is a lot of NHS, you know, government-funded charities out there that give great advice. So if you're a parent or a carer, Harriet, and you're having your first appointment, say, with a health professional, whether it be the GP or even talking to the school nurse, what sort of tips could you give a parent or carer to make the most out of that appointment?
I think it's really kind of, if you've noticed these things for a while, it's just making a little note or a diary or a journal of what's kind of happened.
Okay.
And if there's been any incidences, you know, was it breakfast time? Was it at lunchtime? Was it over? Was it something that your child mentioned before going? But take the notebook with you to that appointment. Maybe you could even have some questions to ask the GP or the health professional or you know, whoever you're seeing, and that could be something like, what help is available, what is around, and what also help can I get? Or what support can I get as well? Take it with you to write things down during the appointment. No one is going to be going, you can't write anything down, because when you're worried, you're not always going to be taking that information in as well.
Yeah, absolutely. And I think it's really important, the point you made about thinking about certain situations and when they happen. And something we encourage in therapy as well is if, you know, your child often, for example, has tantrums when they're not in the home, you know, to write down what happened before, what happened during, and how you responded and how they responded. So you're really marking out that situation, because when you're in it, it's really hard, isn't it, to make sense of. And I think, so journaling's a really great idea and a good resource. And like you said, take it in with you so you can write the notes down as well of what they're saying. So in terms of treatments that are out there, we know that we've said already, sometimes therapy is appropriate, sometimes seeing a psychiatrist is appropriate, and sometimes children are given a diagnosis and not. In your experience, do you find that now with the increase in younger children being referred, there is more of a sort of a push for diagnosis, or is it just general support that families are seeking?
It's a bit of a mixture, to be honest. We do get referrals for psychiatrists, you know, and therapy from as young as 5. And we just see the mixture of that. Sometimes there isn't, the GP won't necessarily always give a diagnosis, but they will give kind of what the symptoms are, what they're presenting with, and maybe what they feel that is the child is presenting. And based on that, then we can help to look what the GP is recommending. Are they recommending psychiatrists? Are they recommending therapy? Or is it an open referral?
Yes.
You know, and then we can kind of help with that. So yeah, it's a bit of a mixture, to be honest.
Because it's hard to know, I guess, for some parents and carers what to expect. So I think what I always say is, because I can diagnose as a clinical psychologist and I can offer therapy and treatment, I can't offer medication. So there's those things that I think sometimes parents and carers aren't always aware of when they come into that appointment. And I always say to families, what is the purpose of the diagnosis? So if I believe it's going to benefit that young person to access more treatment, then of course it's something we will really push more for. But actually, if the purpose of the appointment is to understand what's going on and support the family, that's very different too. So I guess having those realistic expectations about the appointments with health professionals from the beginning is really important. Because it's very different to like when you break your leg, that, you know, there's a clear treatment structure for it. When it comes to mental health, how we express our emotions, how young people do and what they need, might not actually be a diagnosis at that time, you know. And if they're very young, as a clinician, we do think very carefully before we put a label on a child, because it is a label and it is something that's going to be there, you know, on their records. And it's really important as parents to have that conversation, and as carers, with professionals that you're seeing, I think.
Absolutely. And it's being open to it and finding kind of, you know, we know there's no one route of mental health.
Yes. Yeah.
Either. So they might start with one treatment and it might not work and it might not.
Yeah.
It might as well,
yes,
which is
yes,
always really good thing. But, you know, there are always other options with mental health that we can try as well.
It's really important to say that, isn't it? Because I think it's not that, you know, GPs recommended this and we've tried this and it hasn't worked and that's it. You know, there never is a that's it, because one size never fits all. And as clinicians, we always tailor treatment to the child's needs, the family's needs, and what's realistic. Because sometimes these behaviours don't just change overnight, and they don't just change because strategies are changing, we're doing it differently. We have to really work hard at change in mental health, as we do as adults with anything that we want to change, really. So it's not any different, I guess. So when it comes to talking to your child about mental health and sort of trying to work out what's going on for them, I think sometimes parents, and I'm guilty of it, feel pressure to get the answer. However, asking them, how are you and what's going on, doesn't always achieve that answer, does it, Harriet?
No.
And I think, you know, having those more open questions about their day can be more helpful. I mean, what things would you suggest to families that want to open that door to that conversation?
I think sometimes just a simple question of what happened at school today, or what was your favourite thing that happened today, and just opening that conversation. It could be, what was your least favourite thing today? And having a discussion about that, and then that could progress to another questions, or it could be, it doesn't have to be a formal one-to-one conversation. Sure. It could be over dinner. It could be when you're reading a bedtime story, or it could be when you're getting ready in the morning.
Yeah.
You know, it could be at any point in the day, and just being relaxed with them as well.
So when we think about teenagers and talking to teenagers, sometimes we forget that there's other people in their lives that they may want to talk to first, or not as a preference, but who they might find easier to open up to. So it could be, you know, another member of the family or someone at school. What do you think about that? Do you think that's quite a fair point, that sometimes?
Yeah, absolutely. I mean, I think we've all found it sometimes where you might not want to tell your parents what's going on. You might feel, not embarrassed is the wrong word, but you might not want to share that. So you might have someone who you've got a close relationship, and it could be an auntie, an uncle. It could, be someone from your school, or a friend as well. But it could even be if you play football, for example, it could be a football coach. Yeah. You know, someone who you've got a good relationship with that you might want to have that conversation.
And I think it's really important that parents don't feel like that's a bad thing, because actually the fact that your child's opening up is the key here, and it's not to feel like you're not being available for them, because sometimes you're right. I think, you know, children do have their own internal world. As much as we want to be part of that world, sometimes they do need that separateness. And maybe if they describe what they're thinking and feeling to somebody else, and then they've almost rehearsed it with someone, and then they come to you, because that's what we often see, you know, that someone would have heard something, or a teacher might call you in, and then the child opens up, don't they? So yeah, absolutely. So when we think about some online resources for parents and young people, and what sort of things would you recommend, Harriet, to look out for?
I think one of the things I really like, one of the charities which is really good, is Shout. Because we all know teenagers don't like to pick up the phone sometimes and talk. They prefer to text. It's a texting service. They can be put through to a crisis worker who will text back, and they can have those conversations up, and it opens the conversation, because sometimes we all know kids don't want to talk over the phone sometimes. Absolutely. They find it much more easier to write things down.
One of the ones that I really like to use and that I recommend that families look at is Beat. So for eating disorders, it's fantastic, and it's an organisation that's been set up by individuals that suffer with eating disorders, as well as clinicians involved in treatment. So I think that's a really good one. There's also the Minds website, and I think there's Young Minds, isn't there?
Young Minds as well, and I think what's so nice about it, it's got checks for the parents, but it's got parents page on there as well, so they have lots of devices on there for parents as well. Obviously the kids can go on there and access that. They do also have a crisis line as well.
Excellent.
That anyone can call.
Thank you so much for joining me today, Harriet. It's been really insightful and really useful to hear from your experience of working in the NHS and in private medical insurance about childhood mental health. Today we've looked at different scenarios that we're seeing. We looked at the prevalence, and we've also talked about some tips and some insights that we can offer parents and carers to support their young person.
Absolutely. Thank you, Imren.
Great, thank you.